Hello, my name is Kathy Jameson, the Proposition Lady, and today I'm going to give you a preview of one of the many propositions we'll see on the November 2024 ballot. Proposition numbers haven't been assigned yet, so we'll have to get by on descriptions alone. Let's talk about the California requires certain participants in Medi-Cal Rx program to spend 98% of revenues on patient care initiative. Medi-Cal Rx is the program that provides prescription drug coverage to individuals enrolled in Medi-Cal. This proposition lays out some very specific requirements for healthcare providers who are part of the Medi-Cal Rx program and penalizes some providers if they don't spend 98% of certain revenues directly on patient care. When I first started researching this proposition, I thought, wow, what a snoozer. Thankfully, I stayed awake long enough to find out that this initiative is actually more about rent control than the Medi-Cal Rx program. Wait a minute, what? This measure was put on the ballot by the California Apartment Association, or CAA. And when they say certain participants, they mean the AIDS Healthcare Foundation, or AHF. The AIDS Healthcare Foundation is an often controversial nonprofit group that provides health clinics, prescription drug coverage, housing, and other services to people with HIV/AIDS and other underserved people. Part of the AHF's mission is advocacy, and part of how they advocate is via ballot measure. The AHF sponsored this November's ballot measure that seeks to remove barriers to enacting rent control policy at the local level in California. The AHF sponsored similar measures in 2018 and 2020, both of which were rejected by voters. This is where the California Apartment Association comes in. The CAA represents rental property owners, managers, and professionals within the rental housing industry. They are not in favor of rent control policy, and they are tired of fighting the AHF's ballot measures. So the CAA wrote their own ballot measure that, if passed, could force the AHF to divert funding away from advocacy and prevent them from sponsoring future ballot measures. But before we decide how to vote, we'll need to review the specifics of the CAA's Medi-Cal Rx provider proposal. Does it have to be about the AHF, or does it stand on its own as a benefit to patients and taxpayers? I'll be back this summer with a more detailed look at this proposition. I'm Kathy Jameson, the Proposition Lady, and I appreciate you being here with me today. See you soon, California voters. Bye now.